നമസ്കാരം, ഏവർക്കും ലേൺ സൈക്കോളജിയുടെ മറ്റൊരു ക്ലാസ്സിലേക്ക് സ്വാഗതം. ഇന്ന് നമ്മൾ ചർച്ച ചെയ്യുന്നത് MA സൈക്കോളജിയുടെ സൈക്കോപാത്തോളജിയിലെ മുൻവർഷ ചോദ്യങ്ങളും ഉത്തരങ്ങളുമാണ്. ടേം ആൻഡ് എക്സാമിനേഷനായി തയ്യാറെടുക്കുന്നവർക്ക് ഇത് സഹായകമാകുമെന്ന് പ്രതീക്ഷിക്കുന്നു. നമുക്ക് ക്ലാസ്സിലേക്ക് പോകാം. അവേർഷൻ തെറാപ്പി. Aversion therapy is based on conditioning model. In aversion therapy, substance is used is a pair with something extremely unpleasant, such as brief electric shock or feeling of nausea. For example, a person might be offered a drink of alcohol and receive a painful shock, then the glass reaches his lip. Second question, childhood depression. Childhood depression is different from the normal mood shifts and everyday emotions that occur as a child develops. But just sad or depressed does not mean they have depression. But this affected to social activities, school work, family life, etc. He or she is suffered from the medical condition depression. The primary symptoms of depression revolve around sadness, a feeling of hopelessness, and mood changes. Symptoms of childhood depression: irritability or anger, continuous feeling of sadness or hopelessness, social withdrawal, increased sensitivity to rejection, change in appetite either increase or decrease, changes in sleep, sleeplessness or excessive sleep, crying, difficulty concentrating, low energy, physical complaints such as stomachache or headache that do not respond to treatment, feeling of worthlessness or guilt, impaired thinking or concentration, thought of death or suicide. Not all children have all of these symptoms. Most will display different symptoms at different times and in different settings. Most kind with significant depression will suffer a noticeable change in social activities, loss of interest in school, and poor academic performance or a change in appearance. Third question, body dysmorphic disorder. Body dysmorphic disorder refers to the undue concern over body features. According to DSM-4, it is defined as unnecessary preoccupation with an imagined or exaggerated defect in appearance. This imagined defect may be anywhere. For example, the person may have an idea that his nose is too large, etc. Features are introvert, immensely soft-spoken, not interest in communication with others. Fourth question, explain the symptoms of psychotic disorder. Delineate the different types of psychotic disorder. In a psychotic disorder, perception and understanding of reality is severely impaired. The main symptoms are fixed but untrue beliefs or delusion, seeing visions or hearing voice is hallucination, confusion, disorganized speech, exaggerated or diminished emotion. Level of functioning may be seriously impaired with social withdrawal and inability to attend work, relationship, basic personal care. Individuals generally have a little awareness of the mental abnormalities associated with their illness. It may be impossible to identify a specific psychotic disorder due to insufficient information. Psychotic symptoms are described as positive or negative. Positive symptoms. Positive symptoms are delusion, hallucination, bizarre behavior, and thought broadcasting, where the individual believes other can supernaturally influence his or her thoughts or vice versa. Negative symptoms. Negative symptoms refers to a reduction or loss of normal function such as restriction and fluttering of emotion, reduced speech or thought, lack of interest in goal-directed activities. Hallucination are sensory perception that no one else can detect and can involve the sense of sight, thought, hearing, smell or taste. Hearing voice is most frequent hallucination in psychosis. Psychosis is a symptom or feature of mental illness typically characterized by radical changes personality, impaired functioning, and destroyed or non-existent sense of objective reality. Psychosis may appear as a symptom of number of mental disorders including mood and personality disorder. It is also the defining feature of schizophrenia, schizophreniform disorder, schizoaffective disorder, delusional disorder, psychotic disorder such as brief psychotic disorder, shared psychotic disorder due to general medical condition, substance-induced psychotic disorder. Psychosis may be caused by the interaction of biological and psychosocial factors depending on the disorder presence. Psychosis can also be caused by purely social factors with no biological component. Types of psychotic disorder. Schizophrenia. Schizophrenia is probably that one that most people are familiar with because it is seen most commonly in society and in the clinical setting. Schizophrenia is characterized as being a psychotic disorder that has no lasts for at least 6 months and including 2 or more of active phase symptoms, that is hallucination or delusion, for at least 1 month. Schizophreniform disorder. Schizophreniform disorder is very similar to schizophrenia except that it lasts from 1 to 6 months and also they have to be declined in functioning. Schizoaffective disorder. Schizoaffective disorder is characterized by an individual having mood episode and the active phase of symptoms of schizophrenia at the same time. Delusional disorder. An individual with a delusional disorder must have had at least 1 month of non-bizarre symptoms without any other active phase of symptoms. A psychotic disorder due to general medical condition is due to direct relation from physiological condition. A substance-induced psychotic disorder are due to direct physiological condition from medication, drug abuse or toxin exposure. An individual with brief psychotic disorder has experienced at least one of the major symptoms of psychosis for less than 1 month. Fifth question. Discuss the diagnostic features of narcissistic personality disorder. It is one of the several types of personality disorder. A person is overly important to itself. They do many risky things to get the attention of others. The main features are a lack of empathy for others. These are people with the weak pride. Symptoms of narcissistic personality disorder. Have an exaggerated sense of self-importance, exaggerated achievement and talents, inability to understand others. They feel that relationships have imperfections. Others should treat to you according to their expectations. Significant on the person problems and easily feel slighted, feel depressed and moody. Diagnostic features of narcissistic personality disorder. DSM-4-TR specifies 9 diagnostic criteria for narcissistic personality disorder. The clinician to make the diagnosis, an individual must fit 5 or more of the following descriptions. He or she has a grandiose sense of self-importance. He or she lives in a dream world of exceptional success, power, beauty, genius, or perfect love. He or she thinks of him or herself as special or privileged. He or she can only be understood by other special or high status people. He or she demands excessive amount of praise of admiration from others. He or she feels entitled to automatic defense complaints or favorable treatment from others. He or she is exploitative towards others and take advantage from them. He or she lacks empathy and does not recognize or identity with others' feelings. He or she is frequently envious from others or think that they are envious of him or her. He or she has an attitude or frequently acts in haughty or arrogant ways. Sixth question. Discuss the biological and psychological causes of panic disorder. Panic disorder may be divided in biological and psychological factors. The biological factors include genetic factors and biochemical abnormalities in the brain. The psychosocial factors are more concerned with understanding the change in the individual's perception with the triggers panic attack. They include learning factors and the number of cognitive variables that make a trigger of maintain panic attacks. Biological factor. First one, genetic factor. Family and twin studies indicate the panic disorder runs in families. Identical twins seems to have a greater possibilities of panic disorder while concordance in less in fraternal twins. The specific genes responsible for panic disorder are yet to be discovered. There seems some evidence that panic disorder and phobia may have some genetic commonness. Second one, brain and biochemical abnormalities. Attempts have been made to associate panic attack with biochemical characteristics of the brain. Certain biochemical generate panic attack in those who are already suffering from panic disorder, while this may not have any impact on others. Suggestions that there are might be defined neurobiological difference between the normal person and those with panic disorder. Some of such substances which may be considered panic provocation agent are sodium lactate, carbon dioxide, caffeine, etc. Psychological factor. First one, learning factor. The learning theories have tried to explain panic attack as a learned phenomena, especially as responsible to conditioned stimuli. The initial learning is reinforced and increased in vigor by reinforcement in cyclic pattern. The explanation is also known as fear of fear. An initial stimulus may act as the trigger of panic attack. For example, an increased heart rate may be also associated with panic attack experience that if heart rate increase from any reason, panic attack starts. Thus, oversensitivity to internal stimuli can also be a cause of panic disorder. Second one, cognitive factor. The cognitive approach to panic attack focuses on the interpretation of bodily sensation and external cues that may trigger the attack. While the learning approach highlights the oversensitivity to bodily cues, the cognitive approach further affirms that a catastrophic meaning may be assigned to the bodily sensation. Panic disorder patients are also known to demonstrate cognitive bias towards certain experience and symbol. For example, they may be more prone towards likely fainting or shortness of breath. ഇന്നത്തെ ക്ലാസ്സിൽ മുൻവർഷത്തെ 6 ചോദ്യങ്ങളും ഉത്തരങ്ങളുമാണ് നമ്മൾ ഡിസ്കസ് ചെയ്തത്. വരും ക്ലാസ്സുകളിൽ കൂടുതൽ ചോദ്യങ്ങളും ഉത്തരങ്ങളുമായി വീണ്ടും കാണാം. ഈ ക്ലാസ് നിങ്ങൾക്ക് പ്രയോജനപ്പെട്ടിട്ടുണ്ട് എങ്കിൽ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുക, സപ്പോർട്ട് ചെയ്യുക, ഷെയർ ചെയ്യുക. താങ്ക് യു.